For the pre-interaction phase, remember the acronym CPAC. C. Check. Check records, medication record, or obtain an order if necessary. P. Procure. Obtain signed informed consent if needed. Obtains assistance if needed. A. Aseptic technique. Washes hands, dons procedure gloves if needed. C. Collect. Gather supplies and equipment before approaching patient. For the orientation phase, remember the acronym CARES. C. Connect. Introduces self and instructor to patient. Identifies patient, read wristband and asks patient to state his name. A. Assess. Makes relevant assessments, takes vital signs to ensure that the patient still requires the procedure, is able to tolerate it, and that there are no contraindications. R. Rationalize. Explain procedure to the patient, including what he will feel and is expected to do. E. Establish privacy. Provides privacy. Ask visitors to step out, drapes appropriately. S. Support. Uses good body mechanics, positions bed or treatment table to a working level, lowers the near side rail. For the working phase, remember the acronym CARE. C. Control infection. Washes hands before touching the client, before gloving and after removing gloves. Observes universal precautions. Maintains sterility when needed. A. Aesthetic. Maintains correct body mechanics. Performs procedure with acceptable style and art. R. Risk protection or safety. Explains rationale of procedure to the patient. Provides patient safety. Keeps side rail up on far side of bed. Continues to observe the patient while performing the procedural steps. E. Efficiency. Performs procedure in an acceptable period of time. Demonstrates coordination in handling equipment. Follows correct procedural steps. Step 1. Remove the top bedding. Remove any equipment attached to the bed linen, such as a signal light. Loosen all top linen at the foot of the bed and remove the spread and the blanket. Leave the top sheet over the client. The top sheet can remain over the client if it is being changed and if it will provide sufficient warmth, or replace it with a bath blanket as follows. Spread the bath blanket over the top sheet. Ask the client to hold the top edge of the blanket, reaching under the blanket from the side. Grasp the top edge of the sheet and draw it down to the foot of the bed, leaving the blanket in place. Remove the sheet from the bed and place it in the soiled linen hamper. Step 2. Change the bottom sheet and draw sheet. Raise the side rail that the client will turn toward. Assist the client to turn on the side away from the nurse and toward the raised side rail. Loosen the bottom linens on the side of the bed near the nurse. Fan-fold the dirty linen toward the center of the bed as close to and under the client as possible. Place the new bottom sheet on the bed and vertically fan fold the half to be used on the far side of the bed as close to the client as possible. Tuck the sheet under the near half of the bed and meter the corner if a contour sheet is not being used. Place the clean draw sheet on the bed with center fold at the center of the bed. Fan fold the uppermost half vertically at the center of the bed onto the clean side of the bed. Assist the client to roll over toward you, over the fan-folded bed linens at the center of the bed onto the clean side of the bed. Move the pillows to the clean side for the client's use. Raise the side rail before leaving the side of the bed. Move to the other side of the bed and lower the side rail. Remove the used linen and place it in the portable hamper. Unfold the fan-folded bottom sheet from the center of the bed. Facing the side of the bed, using both hands to pull the bottom sheet so that it is smooth and tuck the excess under the side of the mattress. Unfold the draw sheet fan-folded at the center of the bed and pull it tightly with both hands. Pull the sheet in 3 divisions. Face the side of the bed to pull the middle division. Face the far top corner to pull the bottom division. And face the far bottom corner to pull the top division. Tuck the excess draw sheet under the side of the mattress. Step 3. Reposition the client in the center of the bed. Reposition the pillows at the center of the bed. Assist the client to the center of the bed. Determine what position the client requires or prefers and assist the client to that position. Step 4. Apply or complete the top bedding. Spread the top sheet over the client and either ask the client to hold the top edge of the new sheet or tuck it under the shoulders. The sheet should remain over the client when the bath blanket or used sheet is removed. Complete the top of the bed. For the termination phase, remember the acronym CARED. C. Check. Check patient's response to the procedure. Check if patient is comfortable, safe position with call light within reach, returns bed to low position, and raises side rail if client requires this precaution. A. Aftercare. Dispose of supplies and materials according to agency policy. R. Rewash. Washes hands again before leaving the room. E. Evaluate. Evaluates patient's general status. D. Document. Documents that procedure was done. Documents patient's response.